The Parents as Teachers program, I kind of dubbed it a name I haven't told you yet, but I also call it Families as Partners, because I think my whole family is involved in this social event, and it's truly a social event. When residents come to our house, we have so much fun. Sir William Osler, a master clinician of the late 19th and early 20th centuries, once said, "I'd rather know what type of person has a disease than what disease a person has." A parent I know once said, "I want the medical professionals to treat my child as a unique human being, not as a child with a life-threatening illness." These comments share the common desire to be a part of a healing, trusting relationship based on the richness of the individuality of each person. Sir William died in 1919, and I'm not that old, but I can't help but wonder if he wasn't part of the inspiration for the Parents as Teachers program of today. He believed that establishing relationships with his patients would comfort and inspire them and give them the confidence in the ability to get well. He put himself in their place and was not afraid to share his feelings with them. He could elicit trust and confidence with a kind word, a cheerful greeting, a touch, or a sympathetic look. He believed that medicine is learned by the bedside, not in the classroom. I think if he were here with us today, that he would also agree that medicine is learned in the home with parents as teachers. Madigan is my 16-year-old. She has a rare progressive neurological disease called metachromatic leukodystrophy. She was diagnosed at the age of 2, and we traveled here for a bone marrow transplant at Fairview University Hospital. I've learned a lot about myself these last 16 years as well. I know now what I need to lead my family through this uncharted course. I know what I need to feel safe and confident that Maddie's in good hands every single hour of every single day during her medical journey. I believe in Sir William Osler's wisdom, and I need to have a relationship with her medical team to know that they share his beliefs and mine. She's my daughter, not the child in room 6 with MLD. I need to be listened to, validated, and a partner in her healing plan. I don't have a medical degree, but I love and know her better than anyone else, and I take that responsibility very seriously. The Parents as Teachers program allows me and my girls the perfect venue to show young medical professionals what our reality really looks like. It lets them hear and see what they have only learned from books. It lets them see us in a very different light that they would not see us in a hospital or a clinic. They don't see the same thing that they get to see at my home. It lets us see them as unique, compassionate, and caring individuals with only us on their mind. It feels like family, and it creates an atmosphere that promotes openness and honesty. We laugh, and even at times we cry. Every single experience, every single one, is a positive one as we share a part of ourselves and our life experiences. My older daughter feels included and often gets some special attention through questioning from a sibling point of view. One time as I stepped away to attend Maddie, I swear I heard her trying to be a matchmaker on my behalf. Maddie gets to shine as well, as she gets non-medical attention from a medical professional who has the time to truly pay attention to her. She has an eye for the handsome young men, so luckily Pacer and the youth send us all of them. So she loves it when they talk to her, and she can show them she is just like any other 16-year-old girl. She cannot speak, but she doesn't miss a thing, and it's very common, I'm talking about you, Madigan, for her to laugh so hard that her vent starts beeping for 30 or 40 minutes because she's laughing so hard. For me, it's truly a gift. I value the questions I'm asked, and I feel appreciated and respected as I walk a resident through our life and in the manner in which we try to keep some semblance of normalcy. It's adult conversation with someone who is taking time out of their very busy life to better understand what walking in our shoes feels like. I appreciate that more than words can express. The added benefit that I never lose focus of is that perhaps one of those bright young residents will be the one that finds the cure for this devastating disease, or will at least one day run into us in a hospital setting and remember us and for who we are and what disease we have. I believe this program fosters the team or partnership concept better than any program I have ever participated in. A team pulls together to achieve a common goal. Parents and residents together can change the way healthcare is delivered. There's no trade-off between efficiency and compassion, and this program speaks to that. We need to reduce the technical aspects of healthcare and increase the personal and human aspects. This is a stepping stone to that end. The emerging science of patient care, understanding and satisfying a patient or family's needs and expectations is real and could change the way patients value and choose their healthcare professionals. The more we share and listen to each other, the stronger and more successful our team will be. Thank you, PACER and the U of M, for making this program possible. You make a difference.